What's going on, everyone? Happy Thursday. Hopefully everyone is doing well, staying safe, healthy. If you had taken a COVID test, hopefully you have tested negative. If you did test positive, I hope you have a full and speedy recovery with no long COVID issues. It is time now for the Thursday edition of the Virus Update for Thursday, December 12th, 2024. If you're new to my channel, welcome to my channel. This is where I do the virus update as needed on all those viruses that can make us sick. Let's face it, there's a lot of different viruses out there, and each of them can make us sick in their own, each and individual way. Levels of these viruses can vary from state to state. You need to know what's going on with these different viruses. The news does not do a very good job at that. I look up news stories, I look up data, I tweet about them on X, post them on Blue Sky, but I put them into a browser window and bring you these videos to help keep you informed of what is going on. Want to stay informed? Best way to do that is subscribe down below. If you like these videos, give this a thumbs up. Let's try for 200 like button hits today. Of course, the more people that hit that like button, the more this helps me in the YouTube algorithm, as does comments. Got any comments on anything you hear today? Leave your comments down below, and I'm sure there's several things that will lead to comments. Share this video with anyone you know, and remember to hit that notification bell. It's supposed to notify you when I do my updates. I don't know, is it working correctly? Sometimes it does, sometimes it doesn't. Alright, we do have several news stories to talk about today. First thing being something surprising, and check this out. This is from New York City Healthy. This is New York City Health Department. I can't believe they actually made a post on this. A matter of fact, if you read the comments on the post, there's a lot of people saying, thank you. Thank you so much for doing this. And the post is, COVID-19, flu, and RSV are all currently spreading in New York City. Wearing a mask in crowded indoor settings can help protect you and protect others if you're sick. Okay, that's great, but they took it to the next level. Well-fitting masks such as KN95s, KF94s, or N95s provide the best protection. I mean, this is fantastic that they're actually tweeting about this. And no, you're not seeing this like, wait a second, is this 2020? No, this is 2024. And yes, high-quality masks do work. There is only one little caveat that I would say about this. They mention about high-quality masks, but if you notice here, they got in the picture, someone in a little emoji, someone wearing a surgical mask. I would like to have seen that be a high-quality mask, but it's a surgical mask. Whatever, and here's the person coughing. Masking does work if you wear the correct type of mask. Alright, moving on. Thank you so much, NYC Healthy, for posting that. From Channel 3000 News, this is Wisconsin. Wisconsin ranks second nationwide for whooping cough cases, and yeah, this is not good. Wisconsin ranked second nationwide for whooping cough cases, according to latest data from the U.S. Center for Disease Control and Prevention. Whooping cough, also known as pertussis, has sneaked its way into a high number of people. To be exact, Wisconsin's pertussis case count as of Wednesday is 2,080. Get this. This is 4,511% higher compared to reported cases in 2023. Cold-like symptoms start to appear 5 to 21 days after exposure. A severe cough appears after a week, which includes a whooping sound when inhaling. I've been talking about whooping cough cases through either CDC data or different news articles for several months now. This is a real deal. It is a real issue, and I'm sure we're going to be talking about other countries as well. We have talked about other countries in the past. It's just been a while since we've seen anything. Alright, in Florida, COVID is the issue, and COVID is an issue everywhere, but this is quite bad considering it is 2024. Florida's COVID deaths this year, this coming from Dennis the COVID info guy, he tweeted out something from CBS News. Florida's COVID deaths this year reached nearly 5,800. That's ridiculous for this far. I get it. Florida's a populated state. I get it. Florida has a higher population of the older ages, but come on, in 2024, that should not be a thing. And meanwhile, your Surgeon General is saying, oh, don't get the vaccines, don't get the vaccine. Now, right now, someone's getting ready to type a comment down there saying, oh, he's anti-vax. Or someone's getting ready to put a comment down there, well, yeah, you shouldn't get the vaccine, blah, blah, blah. I mean, it's your personal decision, but he should be trying to advocate ways to get these numbers of deaths down in Florida, to get infections down, and to help keep people safe from infections. Instead, he's choosing not to do that. For 11 months, that averages to 524 monthly. Since the pandemic hit the state in 2020, there have been 98,744 fatalities in Florida. That's just awful. Moving on now to other news, and you may already see it on this page. It's our next story. Has to deal with Mariah Carey. You know, she has a hit Christmas song. It really is. It's been around for many years now. All I Want for Christmas Is You. Yeah, she's not saying it right now. No. Instead, there's a song that's replacing that. All I Want for Christmas Is Flu. What do you mean? Mariah Carey is canceling Pittsburgh concert hours before show due to flu. And she says it breaks her heart, and she wanted to sing All I Want for Christmas Is You, but unfortunately, All I Want for Christmas Is Flu has got her instead, and I have already seen people on X say, well, maybe it's not flu, maybe it's really COVID. We don't know. Don't know. Can't say that. I mean, yes, I get it. Insurance purposes, contracts, all these different things prevent them from saying what really is going on sometimes, but as of right now, they're reporting flu, so we have to say it's the flu, and I could speculate to say if she has more shows on the calendar, they could be in jeopardy as well. I guess we'll just have to find out. All right, Arkansas has a real problem with RSV. This is coming from ABC 7 in Arkansas. Department of Health, respiratory illnesses on the rise in Arkansas, and mainly I want your attention to be on RSV here. Little Rock, KATV, RSV cases have been skyrocketing in Arkansas. The Arkansas Department of Health released new information to show that positive cases of RSV started increasing in October and are now at a 22% positivity rate at Children's Hospital in the state. This is not a good thing to see, and I've been showing wastewater states lately, and some of them have been showing rapidly increasing levels of RSV. I do have one in New Jersey I'm showing you today. And if memory serves me correct, I think that is going to be one of those sites that is rapidly rising for RSV. I don't remember. We'll get to that in a little bit. First off, we have to get to this. I found this on X. This is really interesting. Epi Trend. It's not a very big account. It may be a new account for all I know, although it doesn't look like it is. The point is, they are tweeting out this picture here, the screenshot of various different charts of COVID wastewater in other countries. Now, for some reason, the United States, though be it is on here, it's coming up with an error. But check this out. In Austria, COVID in wastewater, it's rising at this time. In Slovenia, wastewater there overall, yeah, it's been rising slightly. France at this time, looks like it was dropping. Now it's starting to rise a little bit. Switzerland, looks like you are starting to drop once again. Sweden is dropping at this time. Again, United States not showing data for some reason. Italy at this time, it looks like their hospitalizations are dropping slightly, but their positive cases on this is starting to rise once again. Now, some of these are wastewater. Some of this is just other data, such as what I just showed you with Italy. Netherlands at this time, wastewater is rising slightly. New Zealand, the overall chart here does show that it is starting to increase for COVID again. Canada has been increasing. Germany is dropping at this time. That's good news. Finland overall has been increasing, but it looks like there may be a peaking going on there. And Berlin, you can't really see it here, but everything in Berlin at this time is dropping. Alrighty, moving on. My daily reminder to you, or at least my reminder when I do these videos, I do have a site. It's datareport.info. Maybe you have a doctor's appointment coming up soon. Maybe you're having a post-COVID issue, and you want to know, could my issue be related to COVID? Well, there is a long COVID section. There's a whole archive of different stuff that COVID can do, and of course, archive about news on other viruses and whatnot, and you can click on something such as long COVID. And maybe you're a young person and COVID has hit you really hard and you never fully recovered. Well, you can click right here where it says long COVID, more severe in young people. and you go to that thread and it will link you to a study that says long COVID can be severe in young people. Or maybe you're just constantly tired post-COVID. Well, guess what? Right here, there's a study that says, study shows fatigue, prominent feature of long COVID. You click on that, then you click on the link to the study, which will take you to CIDRAP, and there you go. There is the study. Alrighty, it is Thursday, which means we do have an update from the UK. And the UK this week reports COVID cases have dropped slightly. 1,081, that is down by 51, or 4.5%. Weekly deaths, 122, that is down by 42, or 25.6%. In healthcare, patients admitted, 1,085, that is up by 16. So, number of people being admitted is up ever so slightly this week, 1.5% increase. Taking a look now at air qualities around the United States, and you will see that there is still pretty big problems with air qualities on the West Coast. Wildfires have been a problem once again in Southern California, and it also is fireplace season. You can see that up in Washington and Oregon, there are some bad air qualities, and a few random bad sites in the Northeast. Not certain what is going on with that. Want to learn more about the climate and the weather? Well, I do have another place where I do that. Not sure if I'm posting a video there today. If I don't, there'll be one there tomorrow. And yes, we may be talking about a white Christmas for some places. It's possible, especially if you're in the mountains of the Northwest. It's pretty much guaranteed. But in the East, yeah, the models, some of the computer weather models are showing potentially a white Christmas. So that's something we'll have to keep our eyes on. It's Climate Data Report is my other YouTube channel. Philadelphia yesterday, no surprise here. 841 EMS incidents were reported, and I have to show you something else from Philadelphia today. We do have Southeastern Pennsylvania Transportation Authority. This was earlier. Yeah, they're back to this again. Operator unavailability, operator unavailability, delays or cancellations due to operator unavailability. It just goes on and on. It's telling me they got a lot of people out sick once again. Taking a live look in at Montgomery County, Pennsylvania right now, and wow, we're almost at 6 p.m. And there are 16 EMS calls right now. And quite a few, wow, respiratory emergency, stroke, respiratory emergency again, seizures. Yeah, just a lot of calls at the moment. Chester County, Pennsylvania has been very busy lately, and we see just a whole bunch of things there. We're seeing sick person, we're seeing heart problems several times. Hey, someone's in labor. Congratulations on the newborn baby to whoever that is. Now taking a look at what's going on with the hospital capacity in Pennsylvania, and we can see the eastern portion of the state is getting hit pretty hard. Lehigh Valley, which consists of Allentown, Bethlehem, Easton, Pennsylvania. You're seeing a lot of yellow show up here, which means hospitals are busy. And you can see here, St. Luke's, Bethlehem, emergency department is nearing capacity at this time. Pennsylvania did post a little bit of an update today to the wastewater. Let me refresh this so you can see that. I was looking at the charts. Fortunately, I would like to show you the charts, but my video of me myself actually cuts that out. I've been going over the charts today, and there's a lot of counties in Pennsylvania with wastewater sites that are starting to rise. Some that are not showing up here yet. They probably will in the near future. And we did see a few new orange sites pop up today. Of course, large decreases in dark blue, not seeing that anywhere. Decrease is in lighter blue, not seeing that anywhere. Insufficient data, we are seeing some sites with that. No change, that shows up as well. Increase and large increase, unfortunately, yes, that's a thing right now. Delaware County, Pennsylvania is seeing an increase. Then you go up to the Lehigh Valley. Lehigh County is seeing an increase. Monroe County reports an increase. One of the wastewater sites in Center County, Pennsylvania, Penn State University, yes, that's now seeing an increase. And there is a big sporting event coming up there. I believe it's the 21st. Penn State Nittany Lions will be doing the first ever in-state college playoff game. That's never happened before. Cumberland County, Pennsylvania is seeing an increase at this time. There is a large increase showing up here in Indiana County, Westmoreland, and Armstrong County. That's starting to see an increase at this time. And not shown on here would be Abington, Montgomery County. If you look at that chart, it is quickly starting to go upward. And some of these charts I looked at, they're almost halfway through their summer peak already. That's not good. And we do know that just a few weeks ago, Pennsylvania was coming in with very high hospital admissions. So that is not a good thing to see whatsoever. Alrighty, moving on now to Canada. And in Canada, COVID-19 viral activity level is moderate, flu A is low, flu B is low, and RSV is coming in high at this time. Taking a look at Walgreens nationally, the positivity rate for COVID did go up 15.2%, and the prior week was 13.3%. National positivity trend overall was up by 1.9%. Testing 5,200 versus 3,696. All right, before we continue on, let's get to some data from CJS A3172, and I don't recall doing this yesterday, so we're going to do 2 days worth of data here. And on Tuesday, he reported Florida daily number. He puts daily, and he also puts whether or not it's weekly. That is very helpful, or weekday. Florida yesterday reported 343 new cases and 1 new death. New Jersey, weekday, 106 new cases on Tuesday after a case data dump hit yesterday. Whoa! Resulting in 2,794 cases being added. New York daily on Tuesday reported 572 new cases. Puerto Rico daily 147 new cases and 3 new deaths. Remember, this he gave to us on Tuesday, so this is stuff from I believe on Monday. Puerto Rico 147 new cases and 3 new deaths. Maryland weekly 606 new cases and 14 new deaths. Maine weekly 432 new cases and 6 new deaths. Michigan weekly 2,470 new cases and 24 new deaths. And wow, 45,587 total COVID deaths since this all started. That's awful. Again, it's not nowhere near as high as Florida, but it's just awful. Virginia, weekly, 1,849 new positive tests and 7 new deaths reported to the CDC data tracker since last Friday. All of the weekly reported case positivity test numbers this is from his Tuesday report, not what I'm about to talk about down below. All of the weekly reported case positive test numbers are increases from last week and from recent weeks for that matter, he says. All right, Wednesday, this was yesterday he put this comment there. Florida, daily, 423 new cases and 8 new deaths. New York, daily, 523 new cases. Puerto Rico, daily, 123 new cases. Arizona, weekly, 2,616 new cases, 410 state-reported hospitalizations, and 23 new deaths, all but 1 over the past 3 weeks. Then we come down to Delaware, weekly, 145 new cases and 2 new deaths. Indiana, weekly, 1,704 new cases and 8 new deaths. Nevada, weekly, 292 new cases and 15 new deaths. That's likely across multiple weeks. Oregon, weekly, 200 new positive cases, 13 new deaths, and a test case positivity rate of 6.5%, tripling last week's test case positivity rate of 2.3%. I'll make that so you can see it. South Dakota, weekly, 400 new cases, and Tennessee, weekly, 1,475 new cases and 3 new deaths. Washington State, weekly, 217 new emergency department visits and 16 new deaths. Alrighty, going back now to my browser here with all the data that we look at. Here we go, yes. Bridgewater, New Jersey. This was the wastewater site. I thought I had this sitting here at the ready for us to see. This is not good. This is really bad for multiple different viruses. First off, COVID. It's listed as high for you. You know what? Let's back up for a second. Population here is served is 130,000. That's a decent-sized wastewater site. Your COVID level is high and rapidly rising at this time. But it gets worse. RSV level is high and it is skyrocketing for RSV at this wastewater site. Now there is also some good news, and the good news is influenza A, though it has gone up, it's still listed at low. Influenza B is still low. HMPV, it's starting to rise, but then it gets bad again. Take a look at norovirus. Norovirus is skyrocketing at this wastewater site. It is listed very high. This is not good to see whatsoever. Mpox, no detections of that. Hepatitis, you have to go back into September to find any detections of that. Not good whatsoever. We talked about Arkansas a little bit ago. Let's go down and check in on Harrison, Arkansas. I want to know what's going on there. And for COVID, it is listed at high, but it is dropping, and I am seeing some of those wonky movements. There's one at the end. RSV at this time. It went up slightly, but it is, looks like it may be starting to drop once again. Influenza A, not detected at this time. Influenza B is low at this time. HMPV is low. Norovirus, it seems like it always comes up high at this wastewater site. Mpox is low, and everything else that is not an issue at this time. Alrighty, moving on, we do have several more things to take a look at. Let's take a look at the hospital statuses in New Jersey today. And we do see Central State Medical Center is on full divert till 1900. Full for everything. That is in Monmouth County, New Jersey. And everything else seems to be up. Nope. The Valley Hospital. This was not like this earlier. The Valley Hospital is saying patient volume. That means they are on an ER divert. And there's another one that's on specialty. Inspira MC Mannington is a surgical divert at this time. New York State today. This is Thursday. This includes New York City. 916 new cases added. You can see it is pretty clear. They're seeing an increase at this time. And the hospitalizations in New York State going up slightly. 512 with 53 people in the ICU at this time. All right, we did get an update today out of Ohio. And Ohio this week reports cases, they're rising, and they're rising at a good rate. A pretty fast pace now. 3,081 new cases reported last week. This week it's 3,812, and I would be surprised if it's not over 4,000 by the time we get to next week. We also note that in Ohio, hospitalizations are rising as well. This week they added 178 people in hospital versus just 119 last week. So that is a pretty big increase. Moving on now to another state. Actually, no. First, we have ICU admissions. They dropped by 1 in Ohio, and deaths have dropped down to 16. Deaths are always the last lagging indicator, so expect them to continue to drop, but they will eventually rise when this wave peaks and we get to the backside of the wave. They will see a rise in Ohio. Taking a look now at Colorado, and some good news, a mixed report from Colorado. COVID is dropping at this time there. Hospital admission count 102, that's down by 22. Emergency department visits is below 1%. Weekly positivity rate is down by 0.75%, 6.94%. Influenza at this time in Colorado, 59%. 59 people were admitted for that. RSV, 31. Positivity rate for influenza at this time is 4.72%, almost 5%, so that's not good, and almost 3% for RSV at this time. And finally, ending in Washington State today. And the percentage of emergency department visits for COVID is low. RSV and influenza 1%, that's gone up slightly. Hospital admissions are actually down for COVID at this time. Remember, Washington State got hit really hard. Colorado also got hit really hard in the summertime. It's one of the reasons why we're not seeing the entire country just rocket ship right now. Because there's not a strong variant, and two, we had a really strong summer wave. So this is actually just going to delay the inevitable. Eventually, we will see a big wave. It probably will not be during this winter wave. It'll probably be maybe in one of the warmer months next year. It could be summers when we see our big wave. I'm not going to speculate when that's going to happen. But the point is, because we had such a big wave back in summer, right now it's why we are not doing a heck of a lot worse for COVID. But these other viruses, you saw RSV today. You saw some influenza data, more so RSV. RSV is really getting bad in the United States. Whooping cough is really getting bad. COVID's not the only game in town, but COVID's the one that goes out there to cause long COVID, which is why you still need to keep yourself protected from COVID and all these other viruses. Alrighty, folks, that does it for the Thursday virus update. If you enjoyed this video, give it a thumbs up. Subscribe if you're new down below. Hit that notification bell. Share this video with anyone you know. And leave your comments down below. I will see you all again next time. Until I see you again next time, stay safe, have a fantastic Thursday evening, and thanks for watching.